David Affleck. I'm a cardiothoracic surgeon at St. Mark's Hospital in Salt Lake City. I've been asked to talk to you today about screening for lung cancer. A low-dose CT scan is a CAT scan that's done with a low dose of radiation, and it basically takes thin slices through the chest in order to detect small nodules in the lung that might be early cancers. So it's a very small radiation exposure, about the equivalent of what a woman might have with a mammogram, and it allows us to get a good picture of the lungs to detect those early cancers. To date, lung cancer screening with low-dose CT scanning is the only screening tool that we have that's been shown to reduce, increase the detection of lung cancer and thereby decrease the risk of death from lung cancer. Patients that are appropriate for low-dose CT scanning are those that have an extensive smoking history, and they're divided primarily into two categories. Age 55 to 74 with a 30-pack year smoking history. So they've smoked a pack of cigarettes a day for 30 years, and even if they've quit smoking in the last 15 years, they still fall in that criteria. The second criteria is someone that has similar age range, but 50 to 74, and they have a 20-pack year smoking history, but they also have a secondary risk factor. So those risk factors can be personal history of cancer, exposure to heavy metals, silica, those sort of things. So the two categories are extensive smoking history of 30-pack years or 20-pack years plus an additional risk factor. So if they're appropriate to be screened with a low-dose CT scan, then they have an annual low-dose CT scan. There's a lot of discussion about negative CT scans after 5 years and then stopping that. Usually we find some small nodules that are benign, and we follow those for some period of time. So the next step would be a follow-up CT scan at an earlier interval if there's something suspicious. If it's a very small nodule, say 5 millimeters, then we might just repeat the scan in 1 year to make sure that it hasn't increased in size. The results of the National Lung Screening Trial show that over 90% of the nodules we find actually turn out to be benign. So greater than 90% of the time, even when we find a nodule, those ultimately are benign. Now, if we find something that's suspicious, so for example, it's a little bit hazy or what we call ground glass appearance, our suspicions raised a little bit, and we follow those more closely. There's a great deal of evidence that nodules that are between 5 millimeters and 10 millimeters, or half a centimeter to a centimeter, can be followed safely for a period of time, provided they don't have those worrisome characteristics. Some of the incidental findings, that means things that we weren't searching for that we find on the CAT scan, are calcification in the heart arteries or the coronary arteries. Occasionally we find a thyroid nodule, and we can even see little cysts in the liver, sometimes in the kidneys or the adrenal glands. Again, mostly these are all benign things that we find, and so they're incidental findings. Depending on the finding, then we may refer the patient for follow-up to a specialist in that area. So for example, someone that deals with thyroid, we may have them meet with that doctor. Most of these findings can be characterized quite easily on CT scan and are known to occur with a certain percentage in the general population.